Welcome to today's tutorial on blood collection tubes. In clinical practice, choosing the correct tube for each test is critical for obtaining accurate results. In this video, we'll guide you through the various types of blood collection tubes, discussing their contents and the specific tests they're used for. Let's dive in. Blood collection tubes, often referred to as vacutainers, are specialized containers essential for collecting and preserving blood samples for laboratory testing. These tubes come in various colors, with each cap color signifying a specific additive inside. These additives are crucial for maintaining the sample's integrity, ensuring accurate results for different types of analyses. Depending on the test requirements, these additives can either prevent clotting, promote clotting, or preserve certain components of the blood. Now that we've laid the groundwork, let's move on to our first type of tube, the purple top tube. The purple or lavender top tube contains EDTA, which functions as an anticoagulant. EDTA works by binding to calcium ions in the blood, a critical component in the clotting process. By removing calcium, EDTA prevents the blood from clotting inside the tube, ensuring that the blood remains fluid and that the cells maintain their shape. This is crucial for the accuracy of certain tests. The lavender or purple top tube is primarily used for hematology tests, such as complete blood count, reticulocyte count, blood film for malaria parasites or abnormal cells, erythrocyte sedimentation rate, and hemoglobin A1C. Remember to invert the tube 8 to 10 times immediately after filling it with blood to ensure thorough mixing and proper anticoagulation of the specimen. The pink top tube also contains EDTA. However, it is primarily used in blood banking and transfusion medicine. This is because it ensures accurate processing and proper handling within blood bank protocols, making it the preferred choice for tests related to transfusions. It is essential for blood typing, cross-matching, and the direct Coombs test. The direct Coombs test is a critical diagnostic tool that detects antibodies bound to red blood cells, helping to identify conditions like autoimmune hemolytic anemia and transfusion reactions. Next, we have the light blue top tube, specifically designed for tests involving the clotting system. This tube contains sodium citrate, which is an anticoagulant that works by binding calcium ions in the blood. The light blue top tube is essential for accurate coagulation studies, including prothrombin time, activated partial thromboplastin time, thrombin time, international normalized ratio, and D-dimer tests. These tests are crucial for diagnosing and monitoring conditions related to blood clotting disorders, such as bleeding tendencies, clotting abnormalities, and the effectiveness of anticoagulant therapy. The yellow or gold top tube is designed for tests that require separated serum. It contains a clot activator, typically silica particles, and a serum separator gel. The clot activator initiates the clotting process, while the serum gel forms a barrier during centrifugation, separating the blood cells from the serum. This tube is used for a wide range of biochemical, serological, and immunological tests, including renal function test, liver function test, lipid profile, C-reactive protein, thyroid function test, hepatitis, and retroviral tests. The gray top tube is easy to remember because it is mainly used for two important tests: glucose and lactate measurements. This tube contains sodium fluoride, which serves as a glycolysis inhibitor, effectively preserving glucose levels by preventing the breakdown of sugar in the blood sample. Additionally, it contains potassium oxalate, an anticoagulant that binds calcium, preventing the blood from clotting. The gray top tube is essential for key tests such as fasting blood glucose, oral glucose tolerance test, and lactate levels. These tests are vital for diagnosing and managing conditions like diabetes and lactic acidosis. The red top tube, though less commonly used, is essential for specific biochemistry tests that require serum, particularly when the separator gel in yellow top tubes could compromise test accuracy. There are two types of red top tubes: glass and plastic. The glass version contains no additives, relying on the glass surface to naturally encourage clot formation. In contrast, the plastic red top tube includes a clot activator, typically silica particles, to expedite the clotting process. This tube is also suitable for serological tests involving viruses, bacteria, or fungi. Green top tubes are available in two types: dark green and light green. The dark green top tube contains sodium heparin, an anticoagulant that works by inhibiting thrombin and other clotting factors, preventing blood from clotting. This tube is often used for tests requiring heparinized plasma, such as assessing ammonia levels in the blood. The light green top tube contains lithium heparin with a separator gel. Lithium heparin also acts as an anticoagulant in a similar manner, preventing clot formation. The separator gel in the light green tube forms a barrier between the plasma and cells after centrifugation, making it suitable for routine biochemistry tests as an alternative to the gold top tube. Both types are essential for collecting and analyzing heparinized samples, with their specific additives catering to different testing needs. Finally, we have blood culture bottles, which are essential for detecting and identifying microorganisms in blood samples. These bottles contain a culture medium that supports the growth of bacteria and is crucial for diagnosing bloodstream infections. There are different types of bottles: aerobic for oxygen-requiring bacteria, anaerobic for bacteria that thrive without oxygen, and pediatric bottles, which are smaller and designed for children. The caps of these bottles are color-coded to indicate the type, though the specific colors can vary depending on the manufacturer. Blood culture samples should be collected using aseptic techniques to avoid contamination from skin flora or hand germs, and ideally before starting antibiotics. In summary, knowing the different blood collection tubes and their uses is key to accurate lab results. Each color-coded tube has specific additives to either promote or prevent clotting or preserve blood components, ensuring sample viability for various tests. Following these guidelines ensures accurate diagnostics and better patient care. Thanks for watching.